I have the great privilege and pleasure to be joined by my good friend and expert in many things, including digital health, Nate Beyor from BCG. Nate, welcome. Most folks listening will probably know you. For those who don't, give a quick background and what you're doing now.
Yeah, sure. I'm a partner at BCG in Southern California. I joined a little over 6 years ago to do digital health work. Currently lead our health tech initiative that sits between our tech and healthcare practices. I work across sectors in healthcare, things like R&D, clinical decision support, data monetization, all things AI these days.
Well, I think what we were going to do was we were both at Health this week, timely meeting, a lot going on. So I think we're going to just sort of focus on what we saw there. So anything in particular you wanted to start with? Any observations?
I went there really just to kind of get the vibe, right? And that was my main goal. I wasn't going there to meet any specific individuals. It was awesome seeing you there. I really wanted to just get a sense for a feel because I remember last year, I mean, it felt like almost .com era kind of energy. And this year, it of course moved to a bigger venue. Frankly, it felt like the whole industry is growing up a little bit. I think that's how it felt. There was a much more of a focus on business over tech, I would say. I had multiple conversations where people would talk about, well, that sounds cool, but really, how are they going to make money? And I'd love to spend time on the cool thing, but we need to focus on real economic viability right now. And multiple conversations on the challenges of venture funding, growth expectations, where that can lead towards missteps in operations and product. And I think I'd say there was just it was a little almost like, let's be a little more measured and paced and really think about the long term of this industry versus just a kind of a short-term growth ambition on tech claims.
Yeah, I think that's right. It's clearly a conference that's still, sort of targeting the innovation side. So a lot of early companies, a lot of VC, but I was surprised with how many big systems were there, how many big CPG companies were there. I didn't see a lot in booths, but health plans were walking around. So it definitely felt more like what's actually going to make its way into market and impact lives and build businesses, as opposed to just, as you said, sort of what's new. Um, Maybe diving into a couple of the areas, sort of going through different sectors in digital health. Anything you saw in virtual care that struck you? I mean, it was a place where I think Walgreens made the announcement that they're rolling out a direct to consumer service. There was a couple of things Walmart talked about. What was your takeaway around virtual care from health?
I've My sense in virtual care is that this is a real thing now. I think for so long, there's this boom in COVID in terms of telehealth visits, and that it came off pretty sharply. And a lot of people were asking, is this real? Is it going to stick around? And actually, if you look at the data, it is sticking around. You're having a pretty steady clip of telehealth penetration overall. Seeing things like Walgreens making this commitment, seeing things like remote monitoring as a category with Huma winning, which of course is all over the place across the sector. I think what we're seeing is just an understanding that this is going to be part of care. And again, we just have to be a little more measured and thoughtful around how we embed it into our existing systems and let it grow, over time, potentially organically.
It's interesting to hear you link remote monitoring into that. I think remote monitoring is a nice use case of virtual care from clinicians either looking at dashboards or following up, and the devices that are needed to do that. Anything you saw in the wearable space, whether that's on the consumer side or innovative devices that are really kind of going through typical medical device stuff?
So not necessarily in wearables, but one company that I met at Techstars about a month ago, which I thought is just really cool. And this is back to it's something cool but uncertain is, it's called Vital Audio.
Okay.
This is a really interesting use of technology where they're actually extracting vital signs from voice. It's sort of comparable to what you might see in a wearable, but can do it in almost a similar passive way with less hardware or more familiar hardware. I really like this notion of decentralizing care, taking these moments of data collection and also kind of direct interaction with patients, and how do you push them across the world that we live in different ways instead of consolidating them into a single experience. That one I see as much more of a technical innovation. It's very much early stage, but I can imagine ways that it might embed into telehealth that could be quite interesting. Similarly, in ways that wearable data could embed into telehealth.
Yeah, and it's clearly one of the first major use cases in AI was around computer vision, and it's a lot of the radiology. I'm seeing a lot in voice as well, sort of taking sound processing against the natural language processing on top of that, and then doing something innovative. We'll get to AI in a second, though. Just pushing on the wearable. Did you see the Aura Headspace announcement that they're sort of teaming up in some way? It's kind of a device, wearable plus virtual care. Any reflection on that particular, just what that might mean for how things are connecting across these subsectors in digital health?
Well, I mean, I think there are natural extensions to AI too, which is that you're seeing models that are. I was having a discussion an hour ago on BCG side where we're talking about like developing multimodal models where you take multiple sources. I think the notion that I can take some sort of streaming data, attach it to an experience or potentially another static set of data and have them interact is really attractive. And very feasible technically. That's the other thing. Like none of this stuff is like it's you can engineer your way to a pretty obvious solution. I think in a lot of circumstances. I think in the Aura case they were talking about actually linking moments of stress to then offer you moments of meditation. That's probably way too simplified, but in terms of what I saw in the press release, this notion that we can actually take our heart rate data, probably better off your HRV data as a model of stress, and then kind of link it to a new experience, I think makes a lot of sense. The applications to me, I actually spent a lot of time thinking about this. I was noodling on some of it over one of the breaks this summer. The applications to me seem more on the wellness side, earlier stage, than they do on the truly clinical one. In many ways, that has a lot to do with the sort of limited set of sensors that we have out in kind of decentralized care and monitoring. It's not a lot of vitals you can collect. But as we grow that over time and get a better understanding of the analytics you can pull from this data, I think it'll get much more rich on the clinical side.
I think that's true. I think some of the interesting use cases I'm seeing on the clinical side are sort of redesigning care. So through some of the work I've done with Mayo, pushing more, what actually was clinical care in a hospital or in a clinic into the home. And then you need to couple that with some type of clinical grade monitoring. So I think the typical use case of like, you're going to come into your primary care doc or you're going to go in the hospital probably doesn't lend itself. But as we think about, as you said, care moving into other locations and redesigning it, we need to put these devices back. So I think the challenge is it's not just the devices aren't there, but they probably don't fit the way we've been delivering care, traditionally.
It's interesting because the one I usually bring up is CGM, right? People talk about remote monitoring and they sort of forget to include CGM as they think about Aura and Apple Watch, but CGM works really well and it's like highly valuable.
Well, but CGM is a unique use case, right? And you and I have talked about this before. So the core use case of CGM is very acute medication, insulin dosing,
yes.
right? And so unfortunately, there aren't a lot of cases where really detailed physiological sensor data feeds a immediate feedback loop in medication. And so I think some of it is a little bit misleading. CGM is importantly in a huge category in of itself, but it's a little bit misleading. In my opinion, it'd be interesting to get your take, particularly when people try to take CGM to like food and you're like, well, do you really need like minute to minute like insulin, blood glucose response to like the sandwich you ate or not? Probably not every sandwich. So I think we're still trying to figure out CGM from insulin dosing to other use cases at scale.
Yeah, that's fair. And I stay close to the guys at GluCare, and I think from my understanding, they found it valuable in terms of driving behavior change too. So not that it's minute to minute, I'm going to completely adjust everything I'm eating, but that beyond your insulin dosing, that signal is one that can cause a patient to take change in their behavior, but also is a signal that can help the clinician actually coach the patient to take change. So having that data actually does create more value, but it only works if you actually have a holistic care stack. In the existing system is bolt-on. It has limited utility. You do need to integrate that care stack.
Well, I think you need to be thoughtful. So even before CGM, first generation, all this stuff, and you and I have both been doing this long enough. Remember, it was like, I'm going to take it off your blood glucose meter, and then I'm going to ping you immediately and tell you to do stuff. And almost invariably, people just turned off the stuff. Like, because it was
alarm fatigue. It's like
exactly. Right. So maybe we'll get one of my ex-colleagues from WW Weight Watchers on to share how the partnership with Abbott is going, because trying to be thoughtful about connecting CGM into lifestyle, but in a way that isn't like you ate this, what happened, but like over time, because I think the models we have need to evolve. In addition to, like we just talked about, If you're a primary care doc and you don't ever outreach proactively, well, what are you going to do with that data, right? So care design needs to be part of that.
Yeah,
What
yeah.
about AI? What are you seeing there? Anything from health that you're just like it's all hype, or there was some real stuff?
Oh no, it's awesome. I mean, Google's announcement to embed their Vertex suite into the provider setting in a bigger way is huge. BCG, we have a strong partnership with Google Cloud. I spend a lot of time there. I was actually at a Google conference last week for Google Cloud,
Are you
and
ever home?
shifting recently, shifting. The way I usually frame it is like I do not see a future without computationally enabled medicine. It just doesn't seem possible. It's just so obviously better in so many ways. There are major things to figure out when it comes to monetization and value creation. Like
Yeah,
for instance, AI radiology, yeah, there's a couple codes, but for the most part, people aren't getting paid. They're
right.
making bets on either operational efficiencies or they just like the innovation aspect of it. And there's a lot of work to be done there, but the tech is so strong. The appetite in the community is so strong. And the appetite from across the board, it's not just providers. I think you see appetite from payers, you see appetite from pharma to be experimenting this sort of thing. The real questions are like, what are the kind of near-term modalities where you're going to see this come up? So
Yeah.
AI radiology is pretty well developed. There's a lot of companies doing this. There's plenty of clearances. Like you take like an ADOC, for instance. What do they have, like 12 now or something? So I would expect that solution to roll out sooner rather than later. When you start to extend towards other types of data, like you mentioned voice data, sort of you could take unstructured notes, leverage AI. We are seeing the sort of like the sort of automated creation of soap notes. Carmen Health made that announcement a few months back on that. Really cool stuff. I would expect more and more of that to occur. However, as on the BCG side, what we're seeing, because I mean, we talk about AI, I don't know, 80 times a day. What we're seeing is there's a lot of talk, but there isn't a lot of really direct focused action beyond POC right now, especially when you're looking in
Well,
gen.
you know what surprised me? Because the clinical use cases get kind of all the press. Some of the admin use cases are obvious, but I was not aware till kind of talking to a bunch of companies in health how advanced some of those admin use cases are. And I saw some folks thinking about voice for like prior auth or benefits verification. You don't actually need to automate like the note. Like there's a whole bunch of folks working on automating doctor note, but there's a whole bunch of phone calls that happen back and forth with like paper sent back and forth for denial. So I actually think, not surprisingly, and even almost obviously, because a lot of these were sort of automated or high throughput processes to begin with, we're going to see the application first into the admin process, billing, claims
Sure.
rejection, benefit verification, just passing data around, the chat bot for the patient who calls in with a question.
The same thing's true on the pharma side too.
Yeah,
Like,
yeah. Well, someone told me a quote. I can't remember who it was, and I wish this was firsthand. But this was something like a hospital CIO says, like 80% of our like tech is the same as any company. Right? It's only the last 20%, and yet that's probably where we spend focus. Now, maybe that's a little bit over
well,
thing, but when you think about AI applied to like supply chain, I know companies think hospital is stocking stuff, like super unsexy use cases, but you run out of gauze or you spend too much on stocking unstable meds that go under, like it's a big issue at a hospital.
yeah, but I mean, when your data architectures and your data systems are different, you actually do need to. There's a lot of work to actually get the tech to work in the same way, even if the
Well,
fundamental
I
sort
mean,
of
that's why
functional.
they need you, right? I just get excited by the product.
But the admin use cases, I mean, I want to call out. We did this work earlier this year with an emergency response org doing document processing. They basically had boxes of paper and we ingested it. And the idea was, okay, if I could put it into some sort of LLM and then it would synthesize the output. But it's like, I think people think about it like it's like the magic box that I just throw things into it and then the magic comes out the other side. It was actually really complex to assemble it. We did this in partnership with Google Cloud and you had
Yeah,
to use Doc AI to process it. We scrubbed all the PI with their
yeah,
data
yeah, oh, yeah. No,
tool. We used the LLM. We actually had multiple branches. We had like one branch that was through prompt chaining creating the template, and the other branch was creating the embeddings. It just took a lot of engineering work. That's what I appreciated about it. What I'm starting to see now are companies doing this sort of thing. And when I ask them about their architecture, it's basically that architecture. And it's the kind of thing that like wouldn't have been possible 6 months ago. And now
yeah.
there's a ton of startups doing this and they do amazing stuff. And so this automated document creation, it seems administrative, crazy niche, kind of boring. but it can take out massive amounts of time, or at least fixed amount of time in really
Yeah.
valuable areas. So
Yeah.
one in IND creation, protocol development and trials, any sort of regulatory filings and database locks. All of those are real time.
I'm smiling because wasn't one of the first use cases of Watson going to like ingest essentially a health plan's benefit guide and then be able to answer real time, like, were you eligible for a thing? I don't think it ever worked, right? But I feel like we're not far, and maybe there's some like sub use cases where you can ingest your health plans thing, who's in network, and start answering some of this stuff pretty close to like on an automated fashion, which now takes probably an hour on a phone to figure out, right?
Well,
No,
again,
am I
talk about
overreading
this
how
hour.
close we are?
Well, no, I mean, the tech works, but you have to get the data there. That's the hard part. I think the challenge in a lot of these things often comes down to a long slog of data engineering work. Then can I get an LLM to do something cool when I actually have the data sitting on a drive right here? Like the POC is easy. The
Yeah.
enterprise grade thing that operates real time is hard.
Yeah, I think that's right. I'm reminded just cleaning data to run flat statistical analysis is an unfun process.
It is
Uh,
an unfun process, and it's expensive when you do it at an enterprise scale.
yeah, I think that's true. Um, any final takeaways? Anything?
I want to come back to the venture thing because I think you and I talked about this a bit. It's interesting because you have these, companies that have, not worked out that are very notable in the industry and that had a lot of money flowing to them. Babylon, of course, being the most notable recently. And then you have companies that have flown under the radar and figured out a business model for themselves, and they have cash flow and a balance sheet, and they're suddenly it's like, oh, they look like geniuses. And I think the industry is just like
Well,
misaligned
I
in
don't know if
terms
they
of,
look like genius. I mean, I think one of the real problems is there's a lot of really exciting businesses to be built that I'm just not sure have venture profile. And
well,
I
and
think
that's exactly
well,
the
but the
key.
point is,
The whole
if
industry
those
is going to
built,
recognize.
yeah, yeah, and I think we collectively, the startup side and the venture side, probably overassume there were venture models, and then it doesn't do anyone a service. You build a real quote unquote operating business, but it's never going to hit venture scale or venture margins, and then it collapses. That sets a bunch of stuff back. I don't know if I have a good solution because these do take startup capital, and I'm not sure where that comes from. This investment, like who takes the risk in a different profile. And I think there's this idea that we're just going to disrupt care and get 80% growth. So no one runs care delivery, even the best, at like 20% growth. So grant you could double it. It's still only a 40 gross business. That's not venture returns and they don't grow as fast. So, but who funds that business, I think is still unclear to me.
I consistently point people to that Bessemer report from earlier in the year that was talking about health tech takes something like 8 years to get
Yeah.
to stable $100 million business. It especially when we do work on the corporate side, because I think people are, they start budgeting for P&Ls over the like 24 to 36 month period. And it's like, hey, it might take a little longer. All
That's the
that
polite way
said,
the consultant says it.
well, I mean, it's a good, nice meta-analysis of the data. All that said, I feel like we are in the trough of disillusionment kind of era,
Yeah,
or maybe we're on the downslope towards the trough of
we'll have
disillusionment.
to see.
I mean, my mindset on this one is like, I think this is probably a really good time to be getting in early stage stuff and just hammering the hell out of your business model, that there's going to be a lot of major upside on the other end of it.
With that, we'll leave it. Nate, thank you.